Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we're really excited to have you here because we are bringing some very exciting conversations with some fierce leaders that are painstakingly reshaping the future of healthcare. And we're really passionate about a few different areas. We're passionate around access to care. We're passionate about healthcare innovation and adoption and leadership. And if it's your first time tuning in, let me just kind of pause for a moment and tell you a little bit about what we're really trying to do here. So our focus is bringing real stories of innovation to life, not just theory. These are with real people that are really innovating day in and day out and sharing wins as well as learnings. If you haven't had the opportunity to check out any historical interviews, make sure wherever you are now, just hit the subscribe button. It doesn't matter where you are, hit the subscribe button so that any new interviews come directly to you. Now, I just want to preface this by saying we've got some phenomenal speakers and folks that are coming onto the show. Like I'm talking action-packed year, like, amazing. So please make sure you subscribe. In our field, things are always moving, things are always evolving. And it's crucial to have leaders that not only just embrace innovation, but they're eagerly addressing a lot of these pressing challenges. And if you've looked around, there's quite a few challenges that we're facing. So our next guest on the show is actually a visionary leader, a leader who's transforming maternal health care for women of color. So Layo George is the founder and CEO of Wolomi, a maternal health startup that's really breaking new ground. So Wolomi supports women of color during their perinatal periods by providing invaluable resources and guidance through an innovative companion app that's designed to improve their experiences and outcomes during arguably one of the most crucial times of their lives. And under her leadership, they've had quite a few little ones. So Wolomi has really crafted a unique community, I'll just say authentic community and platform that offers coaching, guidance as noted. And so before this, she really kind of has done a number of different things throughout her career. She's very impressive. She was a quality improvement specialist at the District of Columbia Primary Care Association, where she really spearheaded a lot of these innovative practices for value-based care transformation and integrated oral health into primary care. So Layo also serves on the board of the Unity Healthcare, advocating for equitable healthcare services. And then her accolades also include participating in the Mass Challenge 2021 and also being honored by the Google Black Founders Fund in 22 and also being a part of Techstars in 23. So today I'm really excited to kind of dive into her inspiring journey and her groundbreaking work with Wolomi and the importance of it and her vision for a world where maternal health disparities become a thing of the past. So Layo, it's great to see you. Welcome to the show.
Thank you so much. Thank you for having me.
Yeah, so as mentioned, your earrings are phenomenal. Before we kind of dig in and dive in, you transitioned from bedside nursing to leading a health tech startup. What were I guess, the challenges and surprises in moving from healthcare to entrepreneurship?
Yeah, how did that journey started, right? That is a good question. As I think about it, I want to say that I grew up in a household where my mom was a nurse. She was a midwife growing up, and I just, I knew that my calling had something to do with women, and I always said that it would, I want to be part of the joy part, part of healthcare, and not sort of like the sad part that I see on the bedside. So I went into I was a labor and delivery nurse. I did primary care, and also and I started to think that a lot of people who are making the decisions in healthcare were not the bedside nurses.
Mm,
Um, and honestly, maybe I'm not as good. I didn't feel like I was as good as I could
mm,
be. And I knew that when I started to understand that people who are calling the shots, who are making the decisions of what needs to happen in the healthcare system, where we're not the people on the bedside, right? They didn't have the control. And I saw a lot of the things that are happening in healthcare. I wanted to be part of the solution and be able to say, hey, here's what we should spend money on. Here's what we should do. And so I started to look outside. And at that point, I saw there was a job opening. I was living in the District of Columbia, and there was a job opening um, for innovation. One of the federal qualified health center had a innovation grants from CMS at the time, and it was to create this care coordination. They were looking for nurses to help spearhead care coordination across the city. Back then, when care coordination was not it was like an innovative thing. And so I was like, that is it. I need to get out of here and like find something that I could think and something different. So I had a relationship with the director of nursing at the health center because I had helped with the primary care vaccine innovation as part of my nursing journey. And so that was it. I got the job and I started to learn. It was a few, 4 nurses. We had an IT team and we were creating our own care coordination platform. And we were supervising community health workers and training them, just really,
Right.
and working with health plans to try to figure out this new thing. And from there, I just kind of got the bug of like innovation and
You
help.
got
Like,
the edge.
yes, I was like, oh my God, this is what is going on in healthcare. One of the CTO of that program, Luigi, he's very innovative and he's always catching up to what's going on in the healthcare system. And he was telling me about all these things like NCQA and all this. Like I was just and I realized then that okay, I need to get into quality because you cannot make a decision about healthcare in this value-based world that's coming. I did not know anything about value-based until I got into that job.
Right.
And unless you know quality. And so I was like, okay, that's my next step. And so that's from there. And of course, IT from value-based, I was like, oh, you know what? I need a master's degree. So I went and got my master's in healthcare administration because I realized that, okay, in order for someone to take me seriously, and I saw how all the degrees that the people in healthcare administration were having, operations were having, it was either MBA or Masters in Healthcare Administration. So I was just prepping myself from there to, but I always was fascinated about the tech part of it. So when I was in grad school at Georgetown, one of my professor told me, he basically was like, every time that we had his class was in business healthcare innovation and the business of healthcare. I think those were the 2 classes. And this is a crazy story. I went into one of those classes and because I was writing a thesis on how to improve maternal health as my exit, for almost every class I would write about anything that's going to help me with my final paper. So in the business of healthcare. And at that time, I was pregnant in grad school, pregnant and just had a baby. So all of these things were happening. And so I was writing about maternal health and so his class was a business of healthcare. I was like, okay, let me put something together that's going to help me with my thesis and let me develop a model of care. My thesis was about different model of care. So in the business of healthcare, I was like, okay, let me pitch. So you will have us pitch at the end of the class. We had this pitch, sort of like a pitch competition. So anyway, I pitched. And then at the end of that semester, he gave me a grade that I didn't want. I was very sad about it. And I remember just looking for him all over campus and be like, hey, I'm trying to get into a fellowship. Why would you give me a B? I need an A. Like, I was good. How do you want me to get into a healthcare administration fellowship with this kind of I was looking for him all over campus.
So you badgered him. Did you convince him?
No. He was like, no, but I
What did you have to do to get the A?
He basically said the only reason I'm calling you back is because I want you to think about innovation instead of going to a healthcare administration when you graduate. I want you to think about that. And I was like, no, how would I have money? I don't even know what that is. But anyway, I took a second class with him. And before we graduated, he was like, what, what about, I don't, because I told him, like, I don't have money. I'm trying to, how would I, I don't have money to go into business. What are you talking about? But he basically told me that he doesn't have the money, but he can shop my ideas around, and so that I feel confident. And once I graduate, I should do it full time. And yeah, and of course the second class he gave me an A, but this is after it convinced me. And I basically thought to myself, especially with maternal health, there's no savior coming to save us. And with my experience as a labor and delivery nurse and also as a mom, I have all it takes. And he's convincing me, when we're talking about the
Yeah.
what God thing, like he's telling
Yes.
me that this is what I should be doing. And I spoke to my husband and he was just like, yeah, that's fine. You can have no income for a while. It's all about, when you're an entrepreneur, it's like, you got to have
Yeah.
income.
You gotta have faith for sure. It kind of a few things, a few thoughts. Number one, fascinating journey. If there's anything that showcases throughout that entire story arc is a few things. One, a lot of grit. Two, you obviously know how to manage adversity and you've got a lot of resilience. So it's like even if you doubt yourself, at least you can fall back on yourself. I have grit. That's not being taken away from you. You have grit. So you have the ability to be able to adapt. And people come into your lives at a certain point, and maybe they only serve a certain instance. Maybe they might not be in your life for the rest of your life. So for example, your professor, do you still engage with that
Yeah,
professor?
he's still there. He's still
Okay, he's still there. So he might be someone that, injected you with a little bit of that
yeah.
belief because you're like,
Mhm.
man, I don't see myself as that. And that professor, he or she was like, no, actually, I see you like this. And they pull
Yeah.
it out of you and they say, here it is. And you're
Yeah.
like, huh, interesting.
Yeah.
And then that kind of gives you a little bit of that belief to keep moving forward. So switching gears for just a second, because I want to kind of talk a little bit about Wolomi, because you guys are acclaimed for having this innovative approach to to improving maternal outcomes. How do you navigate the balance between technology and the deeply personal human aspect of maternal care?
Yeah. That's a good question. One of the things that we do, we're tech enabled,
Yeah.
and so we're human first. One of the our pillars is community, building community, because in this journey, there's nothing there's nothing that you need more than community and not doing pregnancy
Right.
and motherhood alone. And so one of the things that we do is we have this position that we call Mama Companion. So we see ourselves as a companion. Our platform is a companion on this journey. But on top of that, we have something we call a Mama Companion. This is somebody who is from the community, who understands the community. So recently, what we have actually expanded from just focusing just focusing on women of color as of mid last year to expand into even moms of all race in rural areas, right? Just
Mm,
addressing moms who are having challenges on this journey, who might feel alone or who might feel like the system is disappointing them. And so just opening up that umbrella to include those moms. And so for us, it's important to have that companionship for them to feel not alone. So what we've created is on top of our platform, somebody will call Mama Companion, somebody from the community, if who understands the barrier that's happening in that community. So, for example, if you live in a rural area, somebody who has tried to access care from a rural area perspective. If you are a Black mom, if you are a Hispanic mom, somebody who has been there, who understands some of those challenges, somebody if you live in the District of Columbia, for example, somebody who's lived in those areas, who understands, hey, maybe this hospital is not good. Maybe this is, who understand
yeah.
the local challenges. So
Can,
that
can,
person.
Can we
Yeah.
even talk about some of those challenges? Because
Yes.
I don't want to um, even begin to say that, oh, hey, I'm very well versed in them. For someone who doesn't know much about this area, why is this so important? Let's talk about the disparity. I mean, are there statistics that you can kind of cite that's saying, hey, like there's a pretty big gap here, and here's what we're trying to solve. What are some of those challenges?
Yeah. So, for example, Black women are 3 to 4 times likely to die on their pregnancy journey, um, compared to compared to white women. And even when we talk about mental health, you will see that oftentimes women of color of all shades, Asian American, Hispanic American, Black American, Native American, um, they're less likely to be screened and for mental health, depression, or any of those things. And of course, when you're living in a rural area, we have just hospitals, OB hospitals closing at an alarming rate. So we're talking, where do
Mm,
women who want to have babies, where do they go to have to have birth, to give birth, right? So we're talking about they sometimes have to travel an hour, 2 hours to get to when they're in labor to get to care. And you can see
mm,
how that is can bring its own challenges and inequity in a way. And
mm,
so those are the kind of challenges that we're dealing with. Um, and a lot of those things stem from the way the healthcare system sees women in general, sees birthing in general, right? And it's not profitable. So we know that when a healthcare system is in trouble, one of the first few things that they close is mental health and women care, right? Like labor and delivery. That's it. There's no profit in there, and they try to save their bottom line, right? And so we
mm,
know that, especially because there's not a lot of surgery, it's something that you will bill a lot of billing that could happen. And that's why in maternal health, you will see that in the US, C-section rates climbs up because that's a lot of how you make the money in the healthcare system. If you get surgery, then you can bill more. And
mm,
oftentimes when you have surgery happening, moms are when they shouldn't happen, moms are now um, open to complications. That's where a
mm,
lot of the complications happen, infection. That's where a lot of the um, uh, just a lot of the things that could go wrong because C-section is a surgery, and so it opens them up to more comorbidity, something we call comorbidity in the next
hmm
pregnancy. So the more likely that you have a C-section, you're more at risk of
mm,
getting a bad outcome in your next pregnancy. And so there's no incentive in the healthcare system to prevent C-section from happening because the
mm.
cost, the money making, you have
Yeah.
to get surgery is how they make money. And so we have just created this whole maternal health ecosystem that is more of a disease base, that it's better if it's leading to surgery versus a natural thing that happens. And so what
Mm,
Wolomi is trying to do, and a lot of other innovation, is just, hey, how do we pull back a little bit, give the power back to the women on how to really enjoy this journey, because we're creating a lot of sadness and a lot of trauma along the line. Um, we're not even talking about the systemic issues that happen in the healthcare system
right.
where for example, when I go into the healthcare system, I have to dress up to make sure that I'm taken seriously as a Black woman, and all of those things. And even when you talk about a teenage mom, for example, if she's pregnant, regardless of race, right, we know that she's less likely to be taken seriously because she's a teenage mom, right?
Mm,
The she's getting told what to do. So there's a lot of being told versus being a partner in your care that happens in the healthcare system when it comes to birth.
Along those lines, let's just talk about, resistance.
Yeah.
And as someone like you that's advocating for, Black maternal health, um, have you ever encountered resistance from maybe unexpected places? And
Yeah.
yeah,
Yeah.
I mean, what was that moment that made you say, "Wow, I didn't see that coming"?
There are several moments, because when you're talking about Layo or Black woman or Hispanic woman or a woman in general in the maternal
Yeah,
health tech space, that's there's that's the first area of resistance, right? You would think that products made by women, or by the community where data shows statistically that this is a place where we need more work. And the one thing
yeah,
that we don't understand is like if we improve this, where the data is showing us that there's bad outcome, we're improving outcomes and cost saving for all, right? And
yeah,
so when I come into the space and it's like, oh, I'm creating this thing. I've had one in one accelerator program that I was in. One of my advisor kind of looked at me and was like, you know, you should just, instead of trying to do this, you should create an Instagram account and just become an like a healthcare influencer. And I was just kind of like, well, a lot of the most profitable, the biggest maternal health platform I'm run by male. I wonder how many times somebody told them that. And here I am, I've been through this and I cannot, I'm not allowed to scale the way I want to scale. I'm not allowed to touch
right.
lives the way I want to touch lives. I need to relegate myself to some beauty contest. Like not to say that that's what influencers
That's
are, but
yeah, that's there's something about the word should that bothers me personally. I think it triggers a lot of shame. So when I say, "Oh, you should do this," I think the other person that's receiving it, it's very shameful to receive
mhm,
that. So I'm very conscientious of the word selection, and
mhm.
should, I have to say, has been removed personally from my
That's
category.
interesting.
I may want to say, instead of saying should, I'd say, hey, you may want to consider.
Yeah.
Again, giving you the power of the choice. Because as an
Yeah.
advisor, I'm saying as an advisor to many companies,
And I don't even think
to
that's
say
a
you
choice.
should do this is a definitive. And last time I checked, anytime I tell my kids something, hey, you need to do this, there's always resistance
Yes. And I
versus
and when you're talking about a healthcare professional who has created a platform, I don't even think that is a true good fit. Well, I can't judge
well, listen,
anybody,
that's
but
not to say that's not to say that you couldn't start an Instagram account
yes,
to
which we
create an
had at the
audience,
time.
to create an audience and
Yes,
to curate that audience and to get momentum that way. Because the truth of the matter is that many of those that are in that audience could be members of health plans
yes,
and other,
yes.
and other
Which we
communities,
had,
etc.
which that's how we started. We started with a social media, which we had at the time. So that's what's baffling about that, right? Like,
You had,
yes, we still
you,
do.
you
We
still do.
still,
Okay, I was going to
yes,
say,
we
hopefully you
still
didn't get
do.
rid of it.
Yeah, like that's one of the first way that has helped us actually. To your point is that having been out there, creating an Instagram account, and has really helped us to be one of the forefronts of this conversation.
Mm.
But it's just like I just wonder, do guys is that a conversation that happens with guys who come into tech? Like I just wonder
Mm.
if that's something that
Mm.
people so that's one area of resistance. Um
Well, you
um
always have to think about where you're getting the advice from.
mhm,
So one of the best pieces of advice I ever got from someone is a guy named Bill. And he said, whoever's giving you that advice, are they are they better off than you? Like, are they speaking of it from a place where they're
mhm,
actually better off? For example, if someone's trying to give you some tips on marriage, have they been divorced 4 times? Like you
Yeah.
have to take that into consideration. Like, all right, you just have to kind of weigh that out. So where is the source coming from? And having been, in the space, I'd say that there's poor advice that's given more often than you would like to hear.
Hmm.
And and it sounds like though, like, oh, that you know, you've been through the mill, like you've been through a lot. Has there ever been, I guess, a moment where the emotional weight of entrepreneurship and the pressures of it kind of became too much in a moment? And then how do you
Yeah.
navigate that? How do you navigate that? Because there's
Yes.
there's obviously other female tech entrepreneurs that are in your seat that are dealing with that weight. And then how do you
Yeah.
navigate through that personally?
I think one of the, by the way, that conversation, after that conversation, I cried. I just like, it, when talking about weight, I cried a lot after that conversation. I think one of the places of conflicts that happen is motherhood and being a tech founder, or like, being any CEO or any manager, anything, like being a mom and doing that. And I think because there is this expectation that you are supposed to be everywhere. And when you get a child that is young, that is not, that needs their mom, we're not going to, I mean, my husband is great. But we also have to realize that I'm an entrepreneur and he's a breadwinner of the family, right? Like somebody has to have stable income so that I could do this, right? And
Hmm.
so that takes away from me flexibility, right? Like of just not working. And so that becomes part of my journey as a mom. Okay, so and that gets to be too much sometimes. And I know that if you feel like, oh, I need to be in San Diego, I need to be in Chicago, I need to be, oh, well, but I gotta drop my child, like I don't have babysitting is not secure, or like do I really trust somebody to drive my child from
Yeah.
school, like all of those needs. And when you're away a lot, the side effects of that as a primary caregiver on your child, because it does, I've went through that where it's like I'm seeing some changes and have to go to school and have conversation and figuring out, oh, this happens when I'm not around, and what is, so you have to kind of carry a lot and juggle a lot. And yes, it's been, there are times when you feel like you're not hitting the milestone. If only I was, I didn't have this other blessing in my life, and I could just
Yeah.
go free. And that happens. And I know one of the blessings that have happened that has helped me to kind of manage it. Um, when I got into Google for Startups, I'll forever be grateful. Like you said, a lot of the things that come into my life, they blessed us with a therapy for free. As long as you're in that program, you get therapy. And it was so much needed. I was like, oh my God, like for free, like,
Yeah. Yeah.
and
This
at that
therapy's not
point,
cheap.
yeah, it's not, especially when you want one. For me, you get, as a founder, you get to a point where it's like you don't want therapy that's necessarily going backwards, but you want therapy that's going to help you get to where you're going. And so
Yeah.
they were able to match us with people who knew the real life of as an entrepreneur, and like, okay, I don't have all day to unpack my childhood. How do I go to the next meeting, right? Like, how do I manage my
Yeah.
energy to get,
Yeah,
so it's
let's
perfect.
help me equip me on the journey that I'm on now
Yes.
and give me what I need to get there as if you're like a Sherpa and we're trying to get to the top
Yes.
of the mountain and help me.
How do I
You
manage my energy from one bad call to the other? Have you ever
right.
watched
Because
Billions?
not every, 'cause- no, I haven't. I haven't. I'm not
There's
a
a,
huge TV guy, but
yeah, oh yeah. Well,
interesting.
there's a
But I've heard of
therapy
it.
on
But I've heard
there.
of it before.
Yeah, there's a therapist on there who kind of does the same thing for the, anyway,
Okay.
long story short,
I've
that is,
been told by a few people like, hey, this is like talking to is like therapy. So I don't know. I mean,
yeah,
I did originally go to school to become a clinical psychologist, but then I realized that it was going to be hard for me to have a career where I'd be a living receptacle to people's stuff because early on I had a hard time. I would take on a lot of people's stuff because you take it
Hmm.
on yourself because you
Yes.
want to help them so much that you're
Yes.
like, well, let me take it on. But that's actually not healthy. But what you
Yeah.
could do is you can listen to people, and as I've grown in my journey, right, as I've gotten equipped, you have tools that you can use to be able to say, hey, it's okay. You can lighten the load a little bit,
Yeah.
and it's helpful. And I also want to make a comment about what you said about the desire to want to be in all these different places, and yet you also have foundational things that you have to take place. And I think there's a bit of confusion, with entrepreneurs. There's this confusion around activity, and they mistake activity for productivity. So that's one.
Yeah.
And then two is that busy leaders don't make big change. They don't change the world. Focused ones do. So
Mm.
if you're focused, you have to say no to some things. Because if you're saying yes to everything, inadvertently, you're probably saying no to some pretty important things.
Hmm.
So it sounds as though that you've made a conscientious choice to be productive. And it's not about being committed. Sometimes what I see with, tech founders and just founders in general is that this obsession with activity is that they become overcommitted. And being overcommitted means that you lose focus.
It's
Disagree with
hard.
that?
It's hard to stay focused. It's really hard,
Yeah,
because we're in an industry that appreciates a lot of activities.
that's right. That's right. Um, well, let me ask you this. Listen, shifting from a nurse to a CEO, it's not common. I'm seeing it happen more often now. It's not typical. I guess what advice do you have for nurses who maybe might have some dreams of perhaps maybe stepping off of the traditional path? What advice do you have for those nurses?
I would say it's not easy, right? You have to know that it's not like clocking in and getting the paycheck. I think the one of the things you can do is start by innovating where you are, right? Like seeing opportunity for innovation,
Mm,
getting comfortable with how those things work. If you want to stay in healthcare, learning how healthcare works, because oftentimes there is so much on like at the bedside, very focused on that one thing and
right,
loving our patients, which is great. But there's a whole different way you have to think about things when you're when you are in the business of healthcare. And oftentimes you might not be end up being seen as the darling of the healthcare system when you make those changes, right?
that's
When
right.
you become the innovator and the disruptor, or a leader, like a system leader, you're no longer the wonderful nurse. You could change. So be prepared for that. But start where you are. And if you really need to jump, if you figure out something you're passionate about, that keeps you up at night all the time, make sure you save up. Learn about one of the things I wish I did was like learn about how people do tech, tech, what is a tech leader? Like, how do you do it? I did not know about raising. I did not know about anything when I jumped into this, right? And sometimes I wish I did. And I've
Yeah.
raised so that I could have known how to. I see other people who, well, I know people always tell me, don't look at other people, but like I see how other people who might have known a thing or two about doing tech companies, they're further along in raising funds or things like that because I spent a lot of time as a nurse perfecting the model, because I'm a nurse and and so
Well,
anyway.
you want outcomes. You're about quality. That's what you said in
Yes,
the beginning.
yes, and
I mean,
but people,
what good is a press release about raising a bunch of money when your product is not delivering outcomes?
well, well, but the things that you could, there's a middle ground, right? There's a middle
That's right.
ground. Having what I'm appreciating now is like having some of those things help you to fail forward, versus not.
Hmm.
And when you talk about now we're ready. I'm proud of the model that we've developed, and I want to
Mm.
move faster, but
Okay.
kind of like, how do you do that, right? Yeah.
Well, it sounds like you've done a few things. You're thinking big, you started small, and now you're moving quickly.
Yeah.
All right, I want to switch gears because we're getting towards sort of
Yeah.
wrapping up here. So let's do a couple rapid fire questions just to make it fun. Okay. So what's like a favorite book or podcast that has really influenced your thinking?
Podcast. Oh my God.
Or book.
A book. Well, you know what I try to read every time is the CEO of Disney. I
Okay.
try to read his book every year. I
All
haven't
right.
started this year. Yeager. What is the name of that book? Sorry, I'm
That with
terrible with.
Bob Iger.
Yeah, Bob Iger, his book about being a CEO.
Okay.
There's a book. I mean, he goes through his life from being like working at Disney and just working his way up and how to be a good
Okay.
CEO that cares about people.
All right.
So I try
All
to
right.
read that
So
every year. I have not read it this year.
all
I
right.
forget the name of it.
We'll figure it out.
Podcast.
We'll put the link in the description. Don't worry
Yes,
about it.
yes.
All right. So are you when are you most productive? Are you an early bird? Are you an
Oh,
early morning person? You're a night owl. You're an early
early. I
bird.
could
Okay.
start
You're an
at
early bird.
3 o'clock, 3 a.m.
Okay. All right. How about this one? How about like what's your what's like your power song? You know, the one song that gets you in the right mindset every time. What's your go-to song?
Things are gonna be all right by Ty Tribbett.
That's a good one. That's a good one. Very timely. All
I
right.
have
So
I have a
then,
bunch of songs from him, but like, it's all
okay.
about resilience and staying
That's right.
and
That's right.
oh yeah. Anyway.
So then maybe just kind of wrap up last couple of questions is sort of looking towards the future. What's the next big milestone for Wolomi and how can people learn about what you and the team have been doing?
Yes, for us, we really want to. We're working on really being. What does it really mean to be a companion to mom? And looking into how we could be more innovative, and truly be in the people's home, be the first thing that people think about, and really be a companion. And so that's where we want to be, and of course, serving as many moms as possible.
Awesome. Awesome. Layo, it's been a lot of fun talking with you. Thank you for being so rigorously honest and just being very sincere and authentic. And that's always very helpful. And even saying, hey, there's certain things that I'm not necessarily sure about. And yet there's a level of conviction that you have that is, I think that's your superpower. Because when you speak, you speak with authority. You're a clinician, you care, you spew with passion. And my hope is that the audiences that you get in front of and that those that are coming around to support you and rally around you continue to kind of help lift you, guide you, and give you the best possible advice that they can. Hopefully, you won't be getting folks that tell you you should do this, should do that. Rather, be mindful of that. So, for those that have tuned in, if you found this particular conversation to be enlightening and helpful, please would you mind sharing it? Maybe even just indicating what was the part that stood out to you, and give us a like, give us a comment. That'd be great. So Layo, look forward to our next conversation and thanks for joining us today. The door is always open for you to come back and share part two of your journey or part three or whatever.
Yes, and I wanted to make sure that's WOLOMI. You can find us on Instagram as well, at Wolomi app. Thank you.